Welcome to Friday Value Video, and we are really hot and heavy into this series on what proper physical fitness training is and isn't. And we started on strength training last week, and we covered the first half and got into the second side here on strength training physical benefits. So we got up through decreases risk of injury last week. So we are moving on now to improves heart health. And I just think that this is absolutely amazing that strength training can do all of these things for us, and science backs this up. So it's not just my opinion. It's not just some, hopeful list out there. So heart, yes. Strength training can improve heart health because it is shown to decrease blood pressure. So if you've got hypertension, you're on medications, I highly recommend you start doing some strength training. Of course, check with your doctor, make sure it's safe, make sure you're doing it right, make sure you know what you're doing, and you start correctly. But wow, what a difference this can make in your life. It's also seen to reduce total cholesterol and LDL, which is considered the bad guy in cholesterol, your low density lipoprotein. It's also seen to improve circulatory health, which means all of your blood vessels are going to be providing better blood supply to every cell in your body. And it can improve your body weight, make it more optimal, and help with blood sugar levels, which moves us into decreases risk of diabetes. Skeletal muscle literally helps increase insulin sensitivity. It reduces blood sugar levels by removing glucose from the blood and sending it to the muscle cells. So what does this mean? Greater muscle mass you have, better blood sugar management you have. One study following over 35,000 women for an average of 10 years, so an entire decade, showed a 30% reduced risk of developing type 2 diabetes among those who engaged in strength training compared with those who did not. So I'm guessing they didn't just strength train for 1 year and then do nothing for 9. It is a consistent activity. You don't want to stop strength training no matter your age. And we'll get into that. So mobility and flexibility. How on earth can strength training improve your flexibility? I know we all think of those big muscle bound guys, they're not very flexible. That's not the norm. Strength training is literally seen to increase joint range of motion. There was a recent review that compared stretching with strength training, and they found that they both improved range of motion. And a lot of this has to do with the fact that if you are really weak in an area, your body isn't going to allow that joint to bend more, to go through its full range of motion, because you don't have the strength that's needed for that to be done safely. So huge benefits for strength training. And then let's finish up with stronger bones. Stronger bones. Who doesn't want that? A lot of people are very concerned about their bone strength or bone density as they age. And strength training is crucial for bone development. It reduces the risk of osteoporosis and has been seen to improve density. Specific exercises can literally increase bone density in people who have already been diagnosed with osteoporosis. So you want to be doing it. You want to maintain your bone density. You don't want to lose it. And you certainly want to increase it if it's gotten to the point where it's considered a higher risk. Now, you all know I've done a lot of teaching on osteoporosis. So there's a lot of stuff out there that's not really accurate. But if you're concerned about bone density, strength training is one of the most important things that you can do, aside from not eating foods that cause you to lose calcium. That's all I'm going to say on that. Hopefully you've seen some of my other education. Okay, we'll see you next week with the mental benefits of strength training.